This presentation is on surgery, as stated earlier, and we can go ahead and start.
Hello, so first we're going to start off understanding what surgery is. Surgery is the branch of medicine that works with treating injuries, deformities, or diseases with manual and instrumental procedures. Usually this means that surgeons have to cut open someone to treat them. Modern technology has allowed for the cuts or the incisions to be quite small. Reasons someone might need surgery are to remove or repair tissues or organs with disease, to transplant tissue or organs, to implant mechanical or electronic devices, or to further explore and understand a condition for diagnosis. Someone might even choose to have surgery for cosmetic purposes. Next, we're going to move on to the average length of a surgery.
So how long does a surgery take? Well, it depends on multiple factors, but the average surgery takes about 2 to 3 hours. Some of the factors include the complexity of the procedure. So a routine procedure like an appendectomy would take lesser time than a complex procedure like a tumor removal. And also complications. These are problems which occur during the surgery, and this would add to the duration as well. The last thing is sex, weight, and history of the patient. So these are things which factor into the amount of time the patient can be under anesthesia, and this will definitely affect how long the surgery should be. So some examples of routine procedures: an appendectomy, which is the removal of the appendix, takes about an hour. C-section, which is a way to give birth, takes about 45 minutes. Some complex procedures are tumor removal.
Yes.
3块面包。
Okay, so tumor removals, which can take from anywhere up to 3 to 7 hours, and a craniectomy, which is the removal of part of the skull, can take about 3 to 5 hours. So fun fact, the longest surgery ever went on for 4 days straight. It was a surgery of the separation of a conjoined twin. This took place in Singapore, and 20 physicians rotated through the OR for 4 days. So lastly, we're going to talk a little bit about prepping the OR. This image shows the inside of the operating room. The room itself is kept extremely sterile, which means without any dust or dirt, and it is made sure that it is sterile before surgery. The instruments will be sterilized before surgery and will be set up by the healthcare provider. The instruments used will differ from surgeries to surgery. For instance, the instruments used during a heart transplant will be different from the ones used during a C-section. The lights in the room are cleaned with alcohol to prevent contamination of the sterile field. The surgeon and everyone in the OR scrub in, which means they wash their forearms for 1 to 3 minutes, depending on the hospital policy, and wear PPE, which includes a gown, mask, eye protection, and gloves. So this entire process takes about 25 to 30 minutes before the surgery. Next, we will move on to the fields of surgery.
There are 14 surgical specialties. A general surgeon is trained to manage a broad spectrum of surgical conditions affecting almost any area of the body. Cardiothoracic surgery involves the care of patients with pathological conditions within the chest. Colon and rectal surgeons handle issues of the colon, rectum, anal canal, and perianal area. A specialist in obstetrics and gynecology has been trained to provide care for the pregnant patient, deliver babies, and treat conditions that affect the female reproductive system. A gynecologic oncologist is a specialist trained in the comprehensive management of patients with gynecologic cancer. Neurosurgeons deal with the disorders of the nervous systems. An ophthalmologist provides comprehensive care of the eyes and vision. Oral and maxillofacial surgeons are trained to recognize and treat diseases, injuries, and defects in the head, neck, face, jaws, and the hard and soft tissues of the oral and maxillofacial region. They are also trained to administer anesthesia. Orthopedic surgery is specifically devoted to the care of the musculoskeletal system. There are numerous subspecialties of orthopedic surgery, including hand surgery and sports medicine. An otolaryngologist is a physician who has been trained to provide care to patients who have diseases and disorders that affect the ears, respiratory and upper alimentary systems, and related structures. Pediatric surgeons are primarily concerned with the management of surgical problems in children. The specialty of plastic surgery deals with the repair, replacement, and reconstruction of defects of the form and function of the body and its underlying musculoskeletal system. A urologist is a physician who manages benign and malignant medical and surgical disorders of the adrenal gland and of the genitourinary system. Vascular surgeons care for patients with diseases that affect the arteries and the veins throughout the body. We will now be moving on to common tools used in surgery.
So let's talk about some common tools used in surgery. There are several different tools that surgeons use to perform surgery, and each one has a different purpose. Some common surgical instruments include a scalpel, scissors, forceps, clamps, needles, sutures, retractors, a suction, staplers, and clips. A surgeon uses a scalpel to make incisions and cut tissues, and they come in various sizes depending on the type of incision they need to make. Scissors are used to cut tissues as well, and the shape and weight of the scissors vary depending on the situation too. So there are curvy or straight scissors as well as heavy and light. There are many different types of forceps used to grasp tissues or objects. Forceps can be toothed, which are used to handle dense tissues, or non-toothed, which are used to handle delicate tissues. The tools that are also used to hold tissues or objects but also provide hemostasis, which means to stop blood flow, are called clamps. Needles are used to inject or extract substances from the body, and sutures are surgical threads used to repair cuts. Absorbable sutures are dissolvable stitches used for internal stitching, and non-absorbable sutures are non-dissolvable and permanent stitches used to provide long-term tissue support. A device that holds the incision open is called a retractor, and it comes in different forms. A suction helps with removing substances from the surgical field and can allow the patient to breathe again. Lastly, surgical staplers and clips are used during surgery to also close skin wounds, and they reduce the inflammatory response as well as the time it takes to close the wound compared to sutures. Overall, surgeons use a variety of different medical instruments in order to perform surgeries on patients, and these tools are only used for specific situations when it is necessary. Now let's move on to the operating room terminology.
Let's go over some operating room terminology. First, let's start off with irrigation and suction. An irrigation device, as seen on the right, is used to irrigate, which means flood and clean out wounds that have dirt, blood, or anything that the surgeon doesn't want in them. Surgeons need to see what they're doing, and infections are bad news, so irrigation is used to wash out any place that the surgeon needs. Then, a suction is usually used to dry the wound a little, or to suction blood so a surgeon can see what they're doing more easily. Next, a cautery is an agent or instrument used to destroy abnormal tissue by burning, searing, or scarring. For example, if there's an abnormal growth anywhere and a surgeon removes it, they may choose to cauterize the wound to prevent anything from growing back or bleeding. Lastly, a jump room refers to another operating room that is waiting for a surgeon to step in. If you are in an operating room, you may need to be alerted to another room that is waiting for you to finish the current surgery so you can start in the other OR. Let's move on to surgical terminology.
So when doctors and surgeons need to designate surgeries, they use different medical terms composed of different units. The units are composed of 3 categories: the root word, referring to the location of the operation, the prefix, and the suffix. The affixes are used to specify the operation being done. As many of you may have already learned in school, a prefix is placed before the stem word, and the suffix is placed after. Most of these units are derived from Greek or Latin terms. The main suffixes to identify surgery action are ectomy, the action to remove; otomy, to cut a part of the body; scopy, which is observation usually linked with visual observation with an endoscope; plasty, remodeling; graphy, which is imaging; and stoma or stomy, which is creating a deviation of a natural flow. Now moving on to the roots to identify specialties or organs. The main roots are chrondo, referring to cartilage; sato, referring to cells; lipo, referring to fat; angio, related to blood vessels; athero, related to joint; cardio, referring to heart; oto relating to the ear, rhino relating to the nose, and many more that I listed on this slide. Some other important medical terms you may come across that aren't mentioned on the slide include pace, which is the rate of activity, excision, which is removing an organ, prosthetic, which is an artificial device to replace a missing body part, reduction, which is bringing back an organ into position, and resection, which is removing a part of the organ. Now let's learn about the most commonly performed surgeries.
All right, so now that you've been giving a brief introduction into surgery, we'll now present about some specific surgeries. Note that there are so many different types of surgeries that unfortunately, we cannot go over all of them in this meeting. Rather, we will give an overview of notable surgeries. First, let's go over some of the most commonly performed surgeries, some of which you've probably heard before.
Appendectomy is the emergency surgical removal of the appendix, a tube-shaped pouch attached to your large intestine. The purpose of the appendix isn't known yet, and a human can survive without an appendix, but many believe that it's the organ that helps us recover from diarrhea, inflammation, and if the large or small intestines are infected. Appendicitis happens when your appendix becomes inflamed or swollen, which leads to bacteria building up inside. The simplest way to cure appendicitis is to remove the appendix, which is what an appendectomy is for. Symptoms of appendicitis include stomach pain, rigid abdominal muscles, constipation, diarrhea, nausea, vomiting, loss of appetite, and abdominal swelling. Appendicitis usually needs to be treated immediately to prevent any future complications. To prepare for an appendectomy, a patient should avoid eating or drinking 8 hours before their surgery. They should tell a doctor if they are pregnant or might be pregnant, are allergic to latex, certain medications, or anesthesia, or have a history of bleeding disorders. A doctor will perform an exam and gently push on your abdomen to locate the pain source. Because you will be put under anesthesia for the procedure, many patients also need to arrange for a family member or friend to drive them home after the surgery. Before the procedure starts, you'll be hooked to an IV to receive fluids and medication during the surgery and put under general anesthesia. There are two types of appendectomy procedures, open and laparoscopic. An open appendectomy procedure has one cut on the lower right side of your abdomen, and the doctor will clean the appendix if it burst. This procedure also applies to a ruptured appendix or if the infection spreads to your other organs. An open appendectomy is preferred for people who have already had an abdominal surgery previously. The second type of appendectomy is a laparoscopic procedure. In this procedure, the doctor will make multiple small cuts in your abdomen and will insert a small tube called a cannula into your body, inflating the appendix with carbon dioxide to get a better look. The doctor will then stick a laparoscope, a long and thin tube with a light and camera on the end, into your body. The images from within the body will appear on the screen for the surgeon to see, which makes it easier to guide the instruments used for the procedure. This procedure will remove the appendix and is a better option for older patients with less risks than an open appendectomy procedure. An appendectomy surgery usually lasts about an hour, and some complications of the surgery include bleeding, infections, accidentally injuring nearby organs in your body, and blocking your bowels. That's all for appendectomy, and next we'll move on to C-sections.
Now we'll be talking about C-sections. What is it? A C-section is a surgical procedure to deliver a baby through incisions in the abdomen and uterus. If you plan for a C-section in advance, you may be asked to take some blood tests and suggested to talk to an anesthesiologist to prepare for anything that may increase the risk of anesthesia complications. However, it's still important to talk to your healthcare provider about a C-section, even if you don't plan to have one ahead of time, just in case you end up needing to. At home, you may need to shower with antiseptic soap the night before and morning of your C-section. You aren't able to shave your pubic hair for 24 hours beforehand, as it can increase your risk of infection. At the hospital, a catheter, a special tube used to collect urine, will be placed in your bladder and IV lines, intravenous lines, will be placed in a vein in your hand or arm to provide fluids and medication. Also, you will most likely be placed under anesthesia. Regional anesthesia is common, which will only numb the lower half of your body. Spinal and epidural blocks are most common. In an emergency, however, you'd be placed under general anesthesia, which won't allow you to see, feel, or hear anything during the procedure. The procedure involves creating incisions in the skin. The two incisions may be vertical or horizontal. Vertical is belly button to the pubic hairline. Horizontal is a cut across the pubic hairline. Horizontal is preferred as it heals well and there's less bleeding. Deeper cuts into the tissue and a final incision in the uterus are made. The amniotic sac will then be opened and the baby is then delivered. Finally, the umbilical cord is cut, medicine is given, and the cuts are stitched. The entire procedure lasts around 45 minutes. Potential complications could include post-surgery fever, excess blood loss, organ injuries, blood clotting, reactions to medicines and anesthesia, emotional difficulties, scar tissue which could lead to difficulties with future births, the death of the mother, and harm to the baby, all of which are possible. We'll now move on to mastectomies.
Now we'll be talking about mastectomies. A mastectomy is a type of surgery that removes breast tissues from the breast in order to treat breast cancer. Some people may even get mastectomies if they are at a high risk for breast cancer as a way to prevent it. There are some things you should do to prepare for your mastectomy. These things include asking your doctor questions about the procedure, talking to your doctor about medications that you are taking, and not drinking or eating for 8 to 12 hours before the mastectomy. You should ask your doctor general questions about the procedure, anesthesia, your medical history, and breast reconstruction. Since there are a few different types of mastectomies, such as total mastectomy and skin-sparing mastectomy, it is also a good idea to know early on which type you are getting. It is important to tell your doctor about the medications that you are taking because some medications may have substances that interfere with the surgery, and the doctor may advise you to stop taking aspirin in order to decrease your risk of excessive bleeding during or after the surgery. A mastectomy is generally performed under anesthesia, so the patient does not feel much pain. This surgery starts off by the surgeon making an elliptical circle around the breast, which then helps the breast tissue to be removed from the breast. The incision or site of surgical cut is then closed with stitches, which would dissolve or be removed later on. Surgeons may place a few small tubes where the breast tissue was in order to remove fluids from the body. Mastectomies usually take around 90 minutes to perform, and people usually go home the same day or the day after the surgery. There are some risks to mastectomies. These potential complications include excessive bleeding, infection, formation of hard scar tissue, numbness, buildup of blood in surgical site, and swelling of the arm if lymph nodes were removed during the procedure. That was all for mastectomy. I hope you learned something new.
Now on to cataract surgery. So what is cataract surgery? Well, sometimes our eye develops a cataract, which blurs our vision. When this happens, we need cataract surgery. It is usually performed by an ophthalmologist, which takes around an hour. In order to prep for the surgery, you cannot eat or drink 12 hours before, and they will use an ultrasound to look at your eye around a week before, just to get a better idea of how big it is and where the cataract is. When they actually perform the surgery, they will first dilate your pupil. A lot of places will also put in drops of anesthesia depending on your age, so you don't feel anything, making it painless. After this is done, they will remove the clouded lens from your eye, and usually they will implant an artificial lens, as that will help you see better. Some potential complications could include infection, bleeding, and maybe even a loss of vision. But this is a pretty common surgery, and it is performed a lot, so the chances of these are rather low. Also, after the surgery, your vision might still be a little blurry, as it takes a couple of days for your eyes to adjust. When and if you do get the surgery, you should always go with someone, as you might not be able to drive or even walk straight for a bit. Most doctors will also prescribe you with UV glasses that you have to wear for the next year, as your eyes might be extremely sensitive to things like the sun. And that's it for cataract surgery. Marcel will now talk about joint replacement.
So now we move on to joint replacement. Joint replacement means removing a part or all of a damaged joint and installing hardware to allow the limb to move without pain or limitations. To prepare for the surgery, your primary care doctor or an internist will conduct a general medical evaluation several weeks before the surgery. This is to make sure you are safe and risk-free for anesthesia. You will also be asked to take some pre-operative tests, for example, a blood test, x-rays, and possibly even have to provide a urine sample. If you happen to come down with any kind of illness in the week before the surgery, make sure to notify your doctor. In the last 24 hours before your surgery, you'll have some last-minute preparations to do. Make sure to take a shower or bath the night before, and do not shave the area that will be undergoing surgery. Also, you cannot eat or drink anything after midnight. Joint replacement surgery can last anywhere between 1 to 3 hours. It mainly depends on the kind of joint replacement you will be receiving. The procedure itself for all the different kinds are quite similar though. Damaged cartilage and bone is removed from your joint and then replaced with prosthetic compounds, which can either be made of metal, plastic, or ceramic. Although doctors do the best they can do to ensure a safe and successful surgery, there are some possible complications that might occur. Some include infection, blood clots, nerve injury, and loosening or dislocation. However, complications aren't super common, so try not to worry about it too much. Now let's move on to heart transplant surgery.
Hello everyone, now let's talk about heart transplants. If you watch any medical shows, you have probably heard about a heart transplant to make the show a bit more dramatic. However, the medical shows aren't too far off. A heart transplant is basically a procedure where a patient's failing heart is replaced with a healthy donor's heart to improve heart failure. And you may recall heart failure from our previous presentation on cardiology. As scary as heart transplants sound, not everyone will receive one. Now let's go over the preparation to see whether someone will be able to receive a heart transplant. First and most importantly, you will visit a transplant center to see whether you're eligible for a transplant. Some important factors to note is whether you're under 65, have another life-threatening condition, have a history of cancer, and if you're willing to have lifestyle changes for your heart. Depending on your answers, you may not be eligible for a heart transplant. Second, you'll have to wait for a donor. Sadly, there are more people on the waiting list than there are donors, so people might have to wait for a while. During your wait time, the doctors may put you on a device called the BAD, which helps you pump blood throughout your body. Lastly, you'll be notified there is a doctor whose size and blood type matches yours. Thus, you would have to immediately travel to a hospital before the donated heart becomes unusable. Finally comes the procedure. Before the procedure, there will be common preparation techniques like taking off jewelry, using IV fluids, and having various tubes to drain liquids out. First, you'll be put under anesthesia, and the doctors will use a heart-lung bypass machine and a ventilator to keep blood flow and oxygen. The surgeon will cut open your chest and open your rib cages down the middle. They will then remove your heart, sew the new heart, and connect the blood vessels. Lastly, the blood in the heart-lung bypass machine will be returned back to you, and sometimes the doctor will shock your heart to get it starting. They'll cover up all incisions, wrap it, and clear out any extra fluids. Now, this procedure takes around 3 to 4 hours. However, it may take 6 to 8 hours if you use a BAD or had previous surgeries. After the surgery, you'll be on pain medication, ventilators, IV fluids, and heavily monitored in the ICU. Doctors will also perform biopsies where they extract some of your tissue from your heart just to examine whether you're rejecting your heart. Life after a heart transplant varies as well. Most people have improved quality of life, and you would have an 85% survival rate after 1 year. However, some people have risks, such as rejecting the donated heart, heart failure, artery issues, or poor blood circulation. Nonetheless, most patients of a heart transplant will need to improve their diets for the new heart and exercise regularly. Before you go, here's a fun fact. There are multi-organ transplant where you can conduct another transplant in addition to your heart transplant. For instance, there is a heart kidney transplant. Now let's move on to some difficult surgeries to perform.
Now that we've looked at some common surgeries, we will now be moving on to a lot more difficult surgeries. So these are not as common, but they require a lot more skill.
Now we'll talk about a craniectomy. A craniectomy, in simple terms, is a surgery done by neurosurgeons where part of the skull is removed with the purpose of relieving pressure when the brain swells and to ultimately save a life. A craniectomy is most commonly done on patients with a severe brain injury that involves significant amounts of bleeding around the brain or excessive swelling of the brain. This could be brain tumors, hematomas, aneurysms, traumatic head injuries, foreign objects, swelling of the brain, stroke, blood clots, or infections. To prepare for a craniectomy, a patient will first be put under general anesthesia. and then their head will be placed in a 3-pin skull fixation device that attaches to the table in order to ensure it is completely still. If the craniectomy is using image guidance, then infrared cameras will register the head in a 3D computer model using previous MRI scans. However, craniectomies are also often done as emergency procedures, so a surgeon might do a series of tests to determine if there is pressure or bleeding. The procedure itself generally starts by making a skin incision in the scalp, and the skin and underlying tissues are cut and moved out of the way. Next, holes are drilled into the skull. Then the bone flap is lifted, removed, and stored safely so that after the swelling has calmed down, it can be put back in its place. Once the bone is removed, the surgeon will expose the brain and correct whatever problem is occurring. And lastly, the skin and connective tissue are closed with sutures. The patient usually needs to wear a protective helmet afterwards until the bone flap can be screwed back in its place when the patient's condition is stable. The length of a craniectomy varies based on why it's being done, but it generally takes 3 to 5 hours. Just like any surgery, a craniectomy has risks including permanent brain damage, brain inflammation, brain or spine infection, partial or full body paralysis, persistent vegetative state, loss of the ability to speak, a subdermal hematoma, pulling of the infected fluid in the brain, coma, or even death. Overall, a craniectomy is an essential procedure and is no doubt life-saving, but it has to be done in a timely manner and done perfectly to avoid further damage to the brain. That's all for a craniectomy procedure, and we'll be moving on to separation of conjoined twins.
So, separation of conjoined twins is exactly what it sounds like. It is a procedure that would successfully separate two human beings into their own individual functioning bodies. The following are where the twins may be conjoined at. One place is the chest, where the twins often share a heart, liver, or upper intestine. Another place is the abdomen, where they can share a lower part of the small intestine. Another place is the base of the spine, where the twins are joined back to back. And another place is where the pelvis, where the twins tend to be face to each other and share the lower gastrointestinal tract and genital organs. Twins can also share a head where they share a portion of the skull, but the brains are usually separated. However, they may share brain tissues. The doctor always have their materials and surgical equipment ready when you enter the operating room. To prep before the surgery, doctors take in consideration the following. Do the twins share vital organs such as the heart, and are the twins healthy enough to withstand the separation surgery? Odds of successful separation, type of reconstructive surgery, and support needed for each individual twin after separation, and what challenges the twins are met with if left conjoined. Doctors also use scans such as magnetic resonance imaging or X-ray computed tomography scans to allow the surgeons to know where the twins are conjoined and fused at. When performing the surgery, it is very complicated to put in words, but overall the surgeons have to be extremely meticulous on making sure there is enough blood pumping and veins being put into the right spots, because if one twin ends up with too many veins, the heart will collapse, leaving the other twin with too little veins. That can lead to brain swelling with blood. The duration of this surgery can vary depending on how severe the situation is, where the twins are conjoined at. One case took about 55 hours, while another case took about 4 months, performing 3 major operations involving 100 people on the team. Potential complications depends on where the twins are joined. Studies have shown that there are still high risks of serious health problems that may occur even after the surgery, such as development, learning disabilities, or internal organ bleeding. After a successful surgery, 60% of those surgeries survive. As you guys can see, separation of conjoined twins is extremely risky, and a lot is still not known as there are not many cases of it. Now I will pass it on to Liz.
All right, so yeah, this is the end of the presentation. So thank you so much for attending our last meeting of the semester. You guys have been an amazing audience. Do you guys have any questions, or does anyone want us to return to a certain slide before we move on to a fun Kahoot?
How come during knee joint surgery you can't eat before it?
This the person who did that knee surgery one. I think it's Marcel. Yeah.
Yeah. So basically, like it's like a universal procedure for all surgeries. Um, it's like take It doesn't really matter what surgery, even for like neurosurgery, you can't eat before. It's just to make sure everything's flushed out of your system, right? They don't want any external factors, right? They don't know if you're like eating. Let's say you're eating snacks at like 3 a.m. in the morning for some reason, and your surgery's at 6. They don't know what factors might come into play, so they just want to make sure everything's flushed out.
Okay, thank you.
And I think there's a question in the chat about if you have gallbladder surgery, where does your extra bile go? Did anyone talk about gallbladder surgery?
I don't recall. Yeah. Does any of the volunteers know that answer? I'm not completely sure myself.
I'm not 100% sure, but I'm pretty sure it gets clipped. That's what I would say, but don't like take my word for 100%.
Yeah. If you want, also, you can always Google the answer to it. Yeah.
Yeah, and I can definitely send out the answer in the recap email.
Yeah. Anyone else have any questions?
Okay, I think if not, everybody's really looking forward to the Kahoot. But I think there's like 4 minutes left in this meeting, so I think we should rejoin the meeting to play the Kahoot so that we make sure we have enough time for it. So you can rejoin using the same link, and then we'll see you on the other side.